Congrats on making it this far in your erectile dysfunction journey and how to treat it. If you're watching this video, then we have probably talked about why proceeding with the prosthesis may be the best option for you. We may have already tried oral options as well as injectable options. Otherwise, we may have gotten imaging such as an ultrasound to determine that proceeding with a penile prosthesis may be the ideal option for you. This procedure is done under general anesthesia. After you have received anesthesia, we'll clean the genital region and prep and drape in a sterile manner. Then we'll do this surgery through a 2 cm incision, which is either at the base of the penis or immediately above the penis. We identify the corpora, which is the tissue that allowed you to previously have erections, and we develop that space. The space is then measured to identify the exact size of implant that is needed for you. Subsequently, we put the reservoir next to the bladder through the same incision. And this reservoir holds the saline fluid that will allow you to achieve an erection. Lastly, the pump is placed in the scrotum, which is placed either in between the testicles or on either side of one of the testicles. At this point, the incision is closed and the device is left partially inflated. You'll also have a wrap around the penis and the scrotum when you wake up from surgery. The surgery takes about an hour to do, and you would go home the same day. In a very small percentage of patients with predisposing factors and comorbidities, we may ask to observe you overnight for one night at the hospital. Individuals are asked to bring a family member or a friend who can drive them home after the surgery. Using a taxi or a ride share is not an option. In most patients, getting routine lab work prior to surgery is all that is needed prior to proceeding with the procedure. However, in patients with predisposing factors such as diabetes and cardiovascular disease, it may be necessary to get clearance from your specialists. As we mentioned earlier, patients are asked to arrange a ride prior to undergoing the procedure. This can be a friend, a family member who can drive you after you have received general anesthesia. The most important thing leading up to the procedure is making sure that you've obtained appropriate clearances to proceed with the anesthetic as well as the surgery. Most of the medications that you're taking can be continued leading up to surgery. However, during our preoperative visits, we'll discuss which medications may need to be stopped prior to the surgery. Some of these may be your blood thinning medications such as Eliquis, Brilinta, and high-dose aspirin or Plavix. However, other medications can be taken on the day of surgery with a small sip of water. We ask that patients should not eat or drink anything the night before the surgery, starting at midnight. However, as we mentioned before, you can take your medications that have been approved on the day of surgery with a small sip of water. Patients are encouraged to bring supplies that may maintain comfort after the surgery. These may be things such as loose-fitting sweatpants, as well as tight-fitting underwear to provide adequate support to the genitals after the surgery. In addition, you'll spend some time in the recovery area, so consider bringing your cell phone charger as well in case you need to contact your family and your loved ones. Patients are encouraged not to shave leading up to the surgery. However, if you routinely groom, you should refrain from doing that approximately 7 days prior to surgery. Once you're under general anesthesia, we'll plan to shave you under sterile conditions to minimize your risk of infection. You will find the definitive time for your surgery the day before your scheduled procedure. Then you'll report to the preoperative area, and the nurses will give you a gown to change into. You're welcome to have one visitor with you in the preoperative area. After you have changed into the gown, the anesthesia staff as well as I will come by and answer any other questions that you may have leading up to the procedure. We will also give you prescriptions for medications that you will be taking after you're done with the procedure. Once all your questions have been answered, we'll head to the operating room where the anesthesia staff will induce general anesthesia and will proceed with the procedure. It is not uncommon to feel nervous or anxious leading into the procedure, and many times these feelings may be due to the fact that your questions may not have been adequately answered. If that is the case, then we encourage you to contact us via either telephone or through the EMR, and either I or one of our team members will reach out to you to make sure that all your questions are adequately answered. Sometimes it may even help to talk to some of the patients that have previously undergone these procedures, and we're happy to put you in contact with those patients. If you have any questions regarding the procedure leading up to the procedure as well as afterwards, please contact our office directly or through the EMR, and we'll make sure to get back to you as soon as possible.